All right, let's put our hands together for Jill Piazza.
Good evening. My name's Jill Piazza, and I am a proud graduate of Leadership Daytona 33, which is the best class ever. I also happen to work for Adventist Health System, which is the parent company of Florida Hospital. And tonight I'd like to talk to you about some of the problems we're facing in healthcare today and propose a different way to think about how we're caring for the health of our community. I'd like to challenge the notion that our healthcare system actually cares for the health of our community. Our technologies, medical advances, and reimbursement structure in the US still largely incentivize health systems to wait for people to get sick before we care for them. You may know that healthcare spending in the United States is astronomically high, more than twice the average of many other developed countries in the world, in fact. Where has this approach gotten us? Though we find ourselves at the top for spending, we rank at the bottom for quality. You might even know that Volusia County ranks 42nd out of 67 counties in the state of Florida on health outcomes, according to the 2017 County Health Rankings. This is a big problem. We're spending a lot of money and not getting much for it. What you may not realize is the sickest people in our community only make up about 5% of the total population, but account for half of all of healthcare spending. That's because waiting for people to get sick is a costly endeavor that results in unmanaged chronic illness, driving up costs, and not getting anything on the back end. Our traditional approach isn't working. Waiting for people to get sick and caring for them through episodes of care results in chronically ill patients trying to manage chronic conditions in the emergency room, the costliest setting in healthcare that was designed to handle acute emergencies. It's not helping people like you see on this screen. This gentleman's 59 years old, was in our ER 10 times in a 12-month period, battling many chronic illnesses, but we're ill-equipped to help address the fact that he's illiterate, homeless, has no transportation or doctors outside the hospital. Or this woman, who's also 59 years old, in our hospital 12 times in a year period, battling chronic illness, along with the fact that she has low health literacy, no home support, and trying to manage 14 different medications by herself. The cycle that you see on the screen here is essentially what these patients face every time they come into our emergency room. We need a healthcare system, not a sick care system. We need an approach that focuses on maintaining health, empowering our patients, and setting them up for success, not failure. We need an approach with a longitudinal view, one we don't necessarily have today. We're ill-equipped to handle the social determinants of health, the real-life things that impact people's ability to care for themselves, like literacy, income, housing and food insecurity, and social support. Health systems can't do this alone. We need a different approach. What would our health processes and our outcomes look like if we stopped assuming, asked more questions of our patients, and really took the time to understand if they can read the instructions we're giving them, if they have a way to get to their doctor's appointments, or if they can pay for their medications? What if we found an integrated approach targeting the patients who need it the most, really targeting their poor health outcomes and the reasons for them, and empowering them to take better care of their health? I'm talking about an integrated approach that uses interdisciplinary teams to coordinate and manage care in evidence-based ways, focusing on keeping people healthy rather than treating their illness, empowering them to understand their condition and accessing care at the right time and the right place. An approach that has ways of recognizing signs and symptoms of downward decline in health before our patients end up in the emergency room so that we can intervene in real time, providing the tools and resources necessary for chronically ill patients to manage their medications independently at home. What if we engaged our next generation healthcare pipeline in this work, pairing undergraduate college students in meaningful ways with real-life patients battling real-life health conditions before they ever enter their healthcare career? Imagine their perspective. What if we work together with our community partners, our social service agencies, in collaborative ways to address the clinical and the social needs of our patients? What would that impact look like, rather than working in silos? What I'm describing is known in healthcare as the triple aim. The triple aim is the future of healthcare. Our future depends on our ability to reduce costs, improve quality care, and improve the patient experience. How do I know that what I just described achieves this? Because Florida Hospital is doing just that. 3 years ago, Florida Hospital started what we call our community care program. Today, we have over 400 patients enrolled in this program, and we have demonstrated the ability to avoid unnecessary costs, reduce unnecessary hospital utilization, while changing people's lives for the better in very meaningful ways. The gentleman I told you about has been set up on medication delivery services. He has rides to his doctor's appointment now. We've provided education to him at a 4th grade level that he can understand, and he hasn't been in the hospital in over 6 months because he knows now when to call our team for questions versus 911. The woman I told you about developed a very deep bond with her student health coach from Bethune-Cookman. She's using a medication electronic pill box to help monitor her medications and is independently managing all 14 of them now. She was even able to return to college, gaining the skills necessary to re-enter the workforce. So I'd like to challenge all of us to think differently, work together through collaborative partnerships, developing innovative ways to focus on the health of our community rather than the illness, empowering our patients to be better self-advocates in their care. Thank you.
Woo! Woo-woo!